Greetings, my name is Dayne DuVall, and I am from Southeastern University, part of the Geriatric Workforce Enhancement Program. And today I'm going to share with you some ideas about telehealth during COVID. Let me share my screen with you. Okay, so this is facilitating a meaningful telehealth visit for older adults. And this is also for not only for clinicians, but also for support staff. Again, this is part of a grant that the federal government has given Southeastern University. And again, my name is Dayne DuVall. I'm a certified Alzheimer educator, and I am the Alzheimer's and related dementia curriculum coordinator for NOVA for the GWEP, and I'm also the lead for COVID for telehealth during part of the grant. Our learning objectives today will be to understand relevant statistics concerning older patients and telehealth, learn about important telehealth guidelines from HHS and CMS, and learn from case studies on how to and how not to conduct telehealth sessions. So here are the statistics. 65% of those 65 and older have access to the internet via computer, smartphone, tablet. 38% of those people are familiar with video chats with their families and friends, whether it be Zoom, Skype, FaceTime, or what have you. Also, we know that of those people who don't have access to the internet, it can be a problem, but you can also use audio only through telephones. This is all from the Kaiser Family Foundation. More statistics for you are 24% have used telehealth. Of those 24%, 91% reported a favorable experience. In other words, they liked it. 78% say that they would use it again. Also, 52% are comfortable with telehealth, while 30% of them are not. And so it's up to us to figure out how to make those that are comfortable to continue to come back to our telehealth sessions, and trying to convince the others that are uncomfortable how we can make it easier for them. So here's case study number one. 78-year-old female. She lives alone. However, she works full-time. She's pre-diabetic, has hypertension, sleep apnea, chronic pain, and mobility issues. She uses a cane and a rollator at all times. Her first appointment was with her primary care physician. She received an email with a link to download the app to contact with the primary care. They confirmed the appointment via email. The nurse actually called 5 minutes before the appointment to make sure everything was working properly. The patient had set up the tablet and was in the waiting room, quote unquote, for 15 minutes. She thought maybe something was going on because she was waiting, but then she figured, well, maybe it's just like being in the office, I still have to wait. However, when the doctor came online, she couldn't figure out how to make the system work. So the patient's sitting there for 15 minutes, then for another 10 minutes where the doctor was talking, but the patient couldn't hear, the doctor couldn't hear the patient. However, it had already been tested, and so there was a problem with the physician on the other end. This experience, the patient was completely unhappy. She felt that it was confusing, and she felt like the doctor didn't know the system. On her second appointment was with a GI specialist for a first-time consult. The office asked if the patient was familiar with FaceTime. The patient was, so they said that that's how they would contact her. The appointment was confirmed the day before via phone. Then the nurse called and said the doctor was running early, please wait, and then FaceTime started. There was a 15-minute consult, face-to-face through FaceTime. The patient stated that everything worked perfect. Our second case study is a 68-year-old male. He's retired and disabled. He has a live-in care provider. He has HIV, he's HIV positive, but that is managed. However, he has chronic pain from back surgery. He has a neurogenic bladder, and he has chronic peripheral neuropathy. In his first appointment with the PCP, the office confirmed the appointment via email with instructions on how to connect with the doctor. The time of the appointment, the doctor called and then used FaceTime. Patient was in extreme pain. However, he managed the visit with the help of his live-in care provider. They spent 15 minutes on the phone. Doctor was very concerned about his condition, especially seeing that he was in intense pain. He had an additional prescription and then a referral to his pain specialist. The patient, with the help of the live-in care provider, had no complaints with the experience, especially because the instructions that were provided really helped to make the session go well. The second appointment was with his neuropain specialist. He received an email to download an app. They confirmed the appointment via email. He received a text with a link to the app to enter the waiting room. When he was there, he ended up waiting for 30 minutes. Wondering what was going on, he kept thinking maybe something was wrong, but he figured he would wait. So what ended up happening is he waited for a whole hour before the doctor showed up. Knowing that this was the first appointment and that he needed the pain management, he decided to stay that long in this quote-unquote waiting room. The appointment lasted all of 5 minutes, and all the doctor did was prescribe a new pain medication. This patient was very disappointed with the experience because it was a long wait time, especially for such a short amount of time, and then there was confusing instructions, and he wasn't even sure that he was following the instructions properly. Here are some helpful guidelines that I think will help everyone in their practice, whether they're in private practice or group practice or at a healthcare, i.e. hospital or even an ED. So HHS has stated that during COVID, to utilize the apps, even if the app does not fully comply with HIPAA rules. However, these are the apps that they say are acceptable. FaceTime, Facebook Messenger, Google Meetings, which is formerly known as Google Hangouts, Zoom, and Skype. I'm not sure if Google Duo is considered. I would assume that it is, although it wasn't on their list, but Google Duo is private from end to end. HHS says do not use public-facing platforms, for instance, Facebook Live, Instagram Live, Twitch, or TikTok. These are not secure platforms, so please don't use those for any type of healthcare sessions. Now, CMS has provided waivers for telehealth during COVID. And those are to conduct telehealth with patients located in their homes and outside of designated rural areas. I don't know if all of you are familiar, but they had stated that telehealth was being looked at because of rural health areas don't have as many private care physicians. Also, you can practice remote care even across state lines through telehealth, deliver care to both established and new patients through telehealth, and bill for telehealth services, both video and audio only, as if they were provided in person. So the expansion of the telehealth services with CMS is acceptable in emergency departments, the initial nursing facility and discharge visits, for home visit for new and established patients, for therapies, PT, OT, and speech, and for behavioral health and education services. So these are the expansion of the telehealth services during COVID. Here are some tips that we want to share with you. Emphasize the benefits to the patients. Less exposure equal less worry. Explain how it works. Make sure that someone from your office goes over everything that is required for a successful connection and session. Make sure that they have the info, they have the steps and how to connect. Use the language of online appointment, phone appointment, or especially use video chat because that's where they're accustomed to with their friends and family. Try not to say, we're going to confirm your telehealth session with the physician. Make it simple and easy for them to understand. Remember, we're trying to make it so that they understand how easy this is, especially it's easier on both the patient and it's easier for you because all you're doing is making sure that the patient is well cared for without them having to come into your office. Also tell the patients what equipment or technology that they need. Don't assume that they understand. This is where your support staff comes in for being very helpful. Make sure that they understand. Also find out maybe they don't have the technology. If they don't, then tell them that you will be contacting them via telephone. whether it be landline or cell phone. Again, choose user-friendly systems for older adults. Don't assume that the older adults understand something your millennial patients might understand. So make sure that you understand as your office and your practice chooses a system. And if not, make sure that you can use something like FaceTime if what you currently have in practice is too difficult for them to connect to. Know your technology and be on time. I can't stress this enough. You saw in our 2 case studies in both situations that the healthcare providers were very late on each of one of those 2 case studies. And we also saw in one case that the physician didn't understand the technology. She couldn't connect through to the patient within a good amount of time. So here are some references. I'll leave these up for as long as you can. I know it's hard to copy this down because it's a long web address, but here's the HHS General Telehealth info. It's obviously on hhs.gov. Go ahead and copy that down, or just take a screenshot, whether your phone or with your computer. CMS General Provider Telehealth and Telemedicine Toolkit. This is really good to give you the information that and how to prepare for this. And I believe there's also some information on billing in here. More importantly, the CMS MLN booklet telehealth services, that goes over everything. And I believe that especially goes through the billing for different offices and practices. So go ahead and take a screenshot of this so that you can have reference for this later on. Also, what I need you to do as part of our Geriatric Workforce Enhancement Program grant, we would like you to go ahead and, if you have an iPhone, go ahead and just turn on your camera, go to this QR code, it'll pop up. The name of this presentation is Facilitating a Meaningful Telehealth Visit for Older Adults, or you can just put in telehealth for older adults. There are 6 questions that we need you to answer. It really does help us to understand how effective our education programs are through the GWEP. And also it gives us an idea of other things that people might like to learn over the course of the next 4 years of this grant process. Again, if you'll just go to this survey, Android, I believe that there is something that you can use on your phone, or I know that there are QR code apps. I'll leave this up for a little bit longer so that you can be able to access the survey. It's really important for us to get an idea of how many people have watched this program and also understand the feedback. Again, here's my contact information. I'm with Nova Southeastern University, College of Osteopathic Medicine, the Department of Geriatrics, the Geriatric Workforce Enhancement Program funded by the federal government, HHS and HRSA. So if you have any questions or would like to reach out to me, here's my information, how you can reach me. And we hope that you've learned something from this experience today. And keep in mind, make this as easy as possible for your patients. We know that it's easier for them to do telehealth. However, and it makes them feel safer by not having to come into a medical facility. However, it's up to you to make sure that they understand how easy it is. And if they're having problems, help them walk through it. It'll be a big help for you in your practice, in your healthcare community. So again, thank you very much for what you're doing during this time. And I know it's difficult, but we'll all get through this. And thank you very much.